I'm Jerry Dahmen, and my guest right now is Dr. Matthew Stanley with Avera Behavioral Health Services in Sioux Falls. Thanks for joining us today, Doctor.
My pleasure, Jerry. Thanks for having me.
In light of the suicide this week of Robin Williams, we hear so much about depression. What is depression?
It's a great question, and if there's one good thing that comes from a tragedy like this, is that people are asking that question and wondering about themselves and others they care about. But depression is a medical illness just like any other medical illness, and that's why I think a tragedy where Robin Williams just essentially sounds like he just isolated himself for 2 weeks and ended up dying alone and never reached out, as far as I have heard. But it's important, I think, that people understand that it is a medical illness, and as such, shouldn't be something to be embarrassed about or hidden away.
How common is depression today?
It's actually one of the most common illnesses that we encounter. The statistics are actually very high. Oddly enough, and it's of interest to your viewers, women actually suffer about twice as often with depression as men, and that's across the world, so that's not a cultural phenomenon here in the U.S. But so in any given year, upwards of almost 20% of people will suffer with some form of depression. Not always major depression, but there are other forms that are also disabling.
Why do people keep it to themselves? They suck it up, smile, go on, put on a mask.
Yeah, that's a wonderful question. I think the only answer that I know of, Jerry, is that there is still a stigma attached to seeking help, to acknowledging that I am struggling with depression or with a mental illness, and I need to get help.
Can depression lead to suicide generally?
Absolutely. It's not always the case, but far too often, and Robin Williams is an excellent example. I would tell anyone who has thoughts of suicide, you really need to seek help, and there's very good treatment available. One of the things we have to understand, and I think what's hard for people when they've had someone close to them commit suicide, is depression can actually change your perception, affect your judgment. And I think when people are left behind after suicide, they're often asking that question, how could my loved one have not reached out to me? I would have done anything. You have to understand that this is such a powerful illness that people aren't always thinking, we use the term not in their right mind. And it is important to realize that the illness can be that powerful. And in fact, not just suicidal ideation, but when depression gets powerful enough, you can hear voices, see images that aren't truly there. Hallucinations, obviously.
Someone viewing this video right now, Doctor, and that person is really depressed, they keep it to themselves, they're isolating from others. What's your message of hope to that person?
There is good treatment. There are people that understand you and understand the illness and are not judgmental, do not see it as a character defect or a weakness. We understand it's a medical illness. There are many, many people in the Sioux Falls area that are dedicated to treating this very illness. And to reach out. There is more help out there and more people willing to help than you understand.
And there is always hope.
There is always hope. That should be our final thought. Maybe at the end of every day, there is always hope.
Doctor, thank you for joining us today.
Thank you, Jerry.
I'm Jerry Dahmen.